Hello, I'd like to talk to you about medications now. The problem with having a child with a special need is that many parents are afraid of medication. Now, when you think about the reality of medications, if you had heart disease or if you had diabetes, reluctantly or not, you would probably agree to take the medication. But for some reason, when there's a disease above the neck, people tend to be afraid of medications, even though they have the same safety and efficacy as the medications below the neck. So what you want to do is understand the types of medication that your child might need to help his or her condition. Now, for example, many children who don't have seizures still will respond to a medication that's used traditionally for seizure disorders in order to treat a mood disorder, to stabilize their mood. So we often use anti-seizure medications for helping a person stabilize their mood. We also have medications that are used to help control children's violent behavior, and those also are very safe medications, is safe for a child as young as 3 years of age. So those different types of medicines even include the realm of depression and anxiety. So if a child has considerable anxiety from some traumatic experience in their early childhood, then they may very well respond nicely to a medication called an antidepressant. However, that label, antidepressant, seems to scare a lot of parents. However, an antidepressant is a very, very safe medication. We know that it is so safe that it's been studied for 50 years, and its efficacy and safety has been verified over 1,000 times in different doctoral theses. So what should you do if your child does have the need for a medication? You should find a healthcare provider who's competent at prescribing medications, and then use that medication as the indication for what the child needs to help improve his or her behavior. For example, the most common cause of a child's aggressive behavior is unrelated to whether or not the child has aggressive behavior. If a child has aggressive behavior, we can use medications that are perfectly safe to control that aggressive behavior, while at the same time we teach the parents to have more patience, more sabr, when they're interacting with their children, to not intensify the child's angry outbursts. Thank you for listening.
مرحبا ماما، ملاحظة على ابنك اعتماده الزائد عليكي؟ مستغربة ليش؟ تعالي أقول لك شيء. مرحلة الاستقلالية هي المرحلة الثانية من مراحل التطور العاطفي، حيث يبدأ الطفل بالاعتماد على نفسه. علينا أن نشجع أطفالنا وندعمهم على أداء مهماتهم بأنفسهم، لا أن نعمل على أدائها بدلاً عنهم. لماذا؟ لأنه سينعكس سلباً على تطور إدراكهم، قدراتهم على حل المشكلات، وقد يضعف ثقتهم بأنفسهم. عزيزتي ماما، حتى لو كان طفلك من ذوي الاحتياجات الخاصة، فهو يمر بمراحل التطور العاطفي اللي بيمر فيها جميع الأطفال. عليك أن تتحلي بالصبر وأن تساعدي طفلك دون أن تتسببي بتدمير استقلاليته.